Get ready for a short one. This video discussion is about thallium toxicity and Prussian blue, corresponding to Goldfrank's chapters 99 and Antidotes in Depth chapter A31. The learning objectives for this session are that you'll be able to outline the toxidrome seen with thallium toxicity and explain the antidotal mechanism of Prussian blue when used to treat thallium exposure. Thallium exposures are very rare, but they didn't used to be as rare if we go back several decades in time, because thallium was used for some medical indications and also in domestic settings. Thallium had been used as a treatment for ringworm of the scalp, a fungal infection of the skin called tinea capitis. And if you make the hair fall out, which here would be the therapeutic effect of thallium, it helps this fungal infection to resolve. Thallium was also used as a rodenticide, so it might be placed around the house where people, including kids, would have access to it, increasing the potential for inadvertent or intentional self-poisonings. Several other rodenticides shared a similar historic fate, being phased out because they were probably too dangerous for unlicensed domestic use. In more recent times, there have been some malicious thallium poisonings, which can be recognized by its characteristic toxidrome that we'll get to on the next slide. On the lower left, we see a photograph of 9 remaining marzipan candies someone received that were laced with thallium, meaning that 3 of the dozen were eaten. The remaining candies were X-rayed, and we see that they had been laced with radiodense material. Thallium is a metal, and this is what thallium powder looks like on X-ray. Thallium poisoning causes an acute gastroenteritis with abdominal pain, nausea, vomiting, and/or diarrhea, and that's commonly seen with most metals' toxicity. But then, starting some few days later, patients can develop alopecia, hair loss, as well as a painful ascending peripheral neuropathy, meaning that pain and numbness start in the toes and feet, and this progresses proximally. The pain can be so severe that patients can't even tolerate a bedsheet touching their feet. Thallium poisoning is one of only a few potential indications to use Prussian blue as an antidote. Here we see a bottle and some pills of Prussian blue. It's a pigment that's deep blue in color. And this is its crystalline structure that forms a lattice-like network with cubic spaces throughout. Univalent metal cations, that is, metal atoms with a +1 charge, can be bound within Prussian blue's crystal lattice. And the way it works is that there's a cation exchange where thallium is absorbed in exchange for potassium. Prussian blue can absorb many +1 metal ions, but it prefers to bind those with larger diameters, so it can be used to enhance elimination of thallium, which is larger in size than potassium. And it can also be used to help remove cesium. In some radiologic catastrophes, a person could be contaminated with radioactive cesium, so Prussian blue could be used. And this is why the commercial product is called radiogardase, because it guards against radiation from internal cesium contamination. And that's it about thallium and Prussian blue. I'll be seeing you around.